Okay, so I'm going to go ahead and get started. And thank you to everyone for joining. So, if you want to do any of the activities with me today, what you're going to need is a pillow, a rolled towel, and one large bolster or couple stacked blankets or rolled towels, something that's about this big in height. So you could get like a little step stool and put a blanket on it. So if you want to do the exercise along with me, you'll need those things and a yoga mat or something to be on the floor. Also, if you have your shoes that you like to run or walk in, you can go grab them because we're going to be seeing if your shoe is a good shoe for the stability that most of us will need with running, walking, hiking. So just some other housekeeping. I have a little chat box open. So if you scroll to the bottom of your Zoom screen, you'll see a little icon that says chat, and you can enter your questions there. Um, Also, you can, um, I'll be answering all the questions, excuse me, at the end. So just enter your questions in the chat and I'll answer them at the end if you have any. And today's session will be a little bit shorter, but it'll be a little more interactive so you can join me in some of the activities. So let's get to it if you have all your props and things. Um, so I just want to do a little bit of review of the anatomy that we talked about in sessions 1 through 3. And the anatomy is that we are asymmetrical. So we're different right to left. And that is in our cortex, in our brain, the way our brain functions and tells our body to move. But more dramatically, in our physical body, it's very different right to left in our thorax and rib cage, especially the diaphragm. So think about the diaphragm being the center of your core, if you will. So you have a little bit higher dome of a diaphragm on your right. That creates more stability. And that also creates a little bit more support and desire for us to be over onto our right leg. Whereas on the left side, the diaphragm is the leaflet of the left diaphragm is a little smaller, it's a little flatter, it doesn't have as big of a central tendon. So that makes us, again, more want to be on the right side because we have less stability on that left side. So that left diaphragm tends to flatten out, which means that the ribs come up on the left side. Some of us, to stabilize, because you can't really do a whole lot in this position, will kind of pop both ribs up and arch our back. So now both our diaphragms are a little bit flattened, and you can't really rotate well. And in sessions 1 through 3, we talked about the importance of being able to rotate side to side, right to left. Um, so if you want to be able to get both sides down, next week I'm going to talk about a really good exercise to help neutralize you, get you into flexion so you can rotate. We've talked a lot in some of the other sessions about being able to flex, being able to rotate. Today I'm going to talk about your left abdominals. So we all know our abs are important. We all hear about how important the core is for stability and being able to move without hurting our back and all that. But our left abdominals are especially important because they attach right on those lower ribs. And what they're going to do is when they turn on, they're going to help those lower ribs come down and stay down on the left side. So we get a nice dome of our diaphragm on both sides and we can rotate well and transition well right to left. So left abdominals are key. If you can get your left abdominals on and keep those on when you run, that will make your whole running experience or hiking experience or walking experience much less injury prone, much more comfortable, and reduce a lot of pain syndromes that a lot of us have because of that natural asymmetry. Um, so also the left abs tend to not work as hard because they're over lengthened in that ribs up position, and they tend to fatigue faster because they're not used to being contracted, whereas the right side abs are just living in contraction comparatively just because of the anatomy, because of the things we talked about before, because of this preference to kind of push us over onto our right side because of our internal organs. So let's work on a little technique that's going to help you find your left abdominal wall. And I'm going to go through the whole technique, but you might not want to do every step of the exercise because there's several steps. So you just stop where you feel like you can't really feel what I'm asking you to feel, if that makes sense. And it'll make more sense as we go through, but just know you don't have to be doing the full exercise. You can just do step 1 or 2 and get the benefit and do that until you're ready to move on to the next step where you can feel all the right things. So I'm going to show you how I have my mat set up. So I have my little yoga mat, and down on this end, I have my bolster. It's a yoga bolster that I'm using, but you can use a couple rolled blankets, couple folded blankets. You could use a step stool with a blanket on top of it. And then I have one little towel roll, and I have my pillow. So you can set up your station like this, and I'll show you how it looks when you're in it. And if you want to do this along with me, please join me so you can see what it feels like as I talk you through. So what I'm going to do is I'm going to lie on my left side. Left side lying is a great way to develop strength in your left abdominals. Scooch up so you can see me. So this towel roll goes right in my left side waist. So it's not on my ribs and it's not on my pelvis, but it's in that squishy spot right between my ribs and pelvis. Now, as you can see with this pillow, my neck is kind of angling down, which you don't want because that's going to have your right neck trying to be your left abs and your neck is going to tense. So if you're having that happen, grab another pillow or fold over your pillow or blanket. It's really important in these side lying activities that your neck is well supported and your neck is neutral or slightly side bent to the left so that right neck doesn't want to kick in. I'm going to put my right foot on the bolster and I'm actually going to scooch up a little bit more. And that's just because it's important for you to see what my foot is doing. So it takes a little bit of setup and it's a lot of props, but these props help keep our body aligned and prevent us from going into our old patterns. So that's the biggest complaint I get from people is, oh, it's so much setup and it's so many steps, but really that's what makes these effective because you're setting yourself up for success. So here you are lying on your side. I'm just going to take my right hand and put it in front of me like so. And that's kind of reminding me to not scrunch my neck. And you're most likely that's going to be a tendency to do that because our neck wants to be our left abs. So we have to just keep our neck relaxed. And you can even think about drawing your right shoulder towards the wall by your foot. So the first thing I'm going to do is I'm going to reach my right leg long. Do you see what I did there? I just reached it away from me. That already lifted my left sideways. Do you see that? So if you're doing this with me, just try it. Just kind of let your left side body hang on the towel and then reach your right leg away and feel how you lift up off the towel a little bit. So this might be all you do if this feels tricky. And you can see I'm already starting to do that, so I have to consciously bring that down. Next thing I'm going to do is I'm going to press my left hip straight down into the ground. So my left hip bone, I'm going to reach my right leg long, keep that and press my left hip down. And that makes my left abs lift up off the towel roll. So you should feel your left abs starting, your left sideways starting to arc by pressing left hip down. So you might stop here. This is a lot of work, especially if you're not in tune with your left abs. If you have all those and you're like, yeah, Daria, I'm good, you can try and turn your left knee up. But if you turned your left knee up and collapsed in your left side waist, you should not go to this step, okay? So step 1, reach right leg long. Step 2, press left hip down. If you have those, step 3 is turn left knee up. Now, if you turn left knee up, but your whole body rolls back, that's not acceptable. We have to keep everything nicely stacked. So let's go through that again. Step 1, reach right leg long. Step 2, press left hip down. Step 3, lift left knee up. Now what I'm going to do is I'm going to pull the pinky toe edge, the small toe edge of my right foot up towards my head. So look at my right foot. I'm going to pull that pinky toe edge up, but I don't lose that reach. I still am reaching that leg, still pressing left hip, still lifting left knee, pulling right pinky toe back, and if I have all that, I'm going to lift my right leg and breathe here. 4 to 5 breaths, in through your nose, out through your mouth, and wherever you're stopped, that's fine, just breathe there. And let it relax. So all of these things have a feeling. So people often say, well, I'm not sure if I'm doing the exercise correctly. You're doing it correctly if you're feeling what I'm asking you to feel. So I'm going to go through the correct feelings of this exercise. So step 1, reach right leg long. You might feel a stretch in your right side abs, but you should start to feel your left abs lifting off the towel roll. That's feel number 1. You might also feel your right outer hip kind of gluteal area engage. Feel number 2, press left hip down. You should feel your left abdominals, your left side waist. So when I say your left abs, I mean the side abs, not the front abs. So left side abs engage. When you press left hip down, you're feeling left abs, right outer hip. Neck is relaxed. If you have that and you turn left knee up, you should feel left inner thigh, still feel left abs, still feel right hip. Pull right toes, pinky toes back towards you. Now you should really feel your right hip and your left abs and your left inner thigh. And if you have all that, lift that right leg up. And now your right hip is cooking. Those left abs are working, left inner thigh is working. Yeah, that's definitely a tougher exercise, but just know that you can stop. So for many of you, you might just reach right leg long, press left hip down, and just work on trying to even feel your left abs. Because some of us are so disconnected from that, we might not even feel them. If you have the next step of lifting your left leg, just say, oh, do I feel my left inner thigh? Another error that people make with this is when they try to lift their right leg, they stop pulling their pinky toe edge back, which is undesirable because that's how your body pulls you back onto the right side. So pulling the pinky toe edge of your foot back, your right foot back like so, keeps pushing you over to the left. And lying on your left side like this, your body is getting a lot of information from the ground. You're getting a proprioceptive sense from the ground, and that's telling your body, hey, I have this left side. Look at all this left side I have. It's giving a lot of awareness and input into that side of your body. So there's a lot of cool things about this technique. And it's very powerful for runners or anybody who's doing like a repetitive bipedal activity. So walking, hiking, skating, running, sprinting, all those things. Okay. So I hope that was helpful for you and that you were able to try it with me. And if you weren't, this recording will be available so that you can try it at home. And of course, I'll put a link up for the exercises in the chat box so you can access all the exercises in the entire course. Um, so if you haven't already, scroll to the bottom of your Zoom screen and click on the little chat box. It's a little chat button. And in there, you'll see I've uploaded a PDF. And it's basically this shoe list. So if you've worked with me, you've probably seen this shoe list. It's from the Huruska Clinic in Lincoln, Nebraska. And this is the clinic that I've trained with and I trust them. And every year they go through all the new running shoes that are out because they're putting out new shoes every year. And they pick which shoes that year meet a certain criteria. And that certain criteria is how we decide whether a shoe is a good shoe as far as it's going to provide you the proprioceptive awareness that your body needs to be able to sense the ground well, to be able to shift well right to left. The reason I like this list is because it's looking at a whole body. It's looking at your proprioceptive sense. It's looking at how your brain is talking to your body based on the information you're getting from your feet. So a lot of other shoes are created based on, do you have a high arch or low arch, or what kind of support you need in different areas. But that doesn't really make sense unless you have like a severe foot deformity, because you have a whole body on top of your feet. So we need to look at all the neurological and physical influences and the sensory inputs that you're getting from those shoes versus just, sticking a wedge in here or there, or, fixing a pronation or antipronation. Those things aren't going to have more of an impact than just your foot. And we can't, I know I've said this before, we can't forget there's a whole person on top of that foot. So, before I go, I'm going to go through this list and I'm going to tell you using this, how you can use this list to pick a shoe. And these criteria that I'm going to go through apply to any shoe. So if you are having trouble finding a dress shoe for work or just a casual shoe to wear around that's not a tennis shoe, you can go through and apply these criteria when you're shopping for shoes, and it'll help you pick a good shoe. Before I go through that criteria, I'm just going to go through a couple key points for runners. And this is sometimes where my patients don't like me very much, because I can be a little bit bossy about shoes, but it really does make a difference. Not just when you're running, but all of the time. So that's not to say, oh, you have to wear these tennis shoes all the time. If you're one of my patients and you're in rehab and you're working on rehabilitating, it is really important for most people to wear a good shoe as much as possible, because what that shoe is doing is it's allowing your body to hold the new pattern. So we're trying to get you out of an old pattern, but if you sense the ground you always did, you'll go back to your old pattern. But what this shoe does is it gives you new information and helps your body understand, okay, I've shifted to a new pattern, a better pattern, and it helps you hold that. So it'll just make your recovery easier and faster. So that's side note if you're in rehab. Once you're done with rehab, you can wear, your cute shoes whenever you want, your boots or heels when you go out to dinner. But still, like if you're going to be walking all day, or if you're going to be, on your feet for a long time or traveling, then yeah, you want a good shoe. I mean, it just is logical and makes sense. So that's my 2 cents on it. here's some other things that my runners don't like to hear, but I just think it's important to share with you. So, wearing good shoes that support your heels, and I'll talk about that when we go about the criteria, but essentially, you want a shoe that's going to give a little hug around your heel bone. So if this is your heel, the back of the shoe gives a little sensory awareness, not just on the bottom, but around the sides. Because what happens is our heel bones are supposed to be able to wiggle and wobble in the frontal plane. So if you're looking at me straight ahead, here are my toes, here are my heels. They need to be able to move in and out. But if you've lost good sense of the ground, and that happens to most of us because we end up spending a lot of time sitting, or we get stressed and we have to brace ourselves. That bracing is we stop wiggling and wobbling our ankles, and our ankles just kind of turn in and stiffen. So that's not that your ankles got stiff because you got old. It's that your body doesn't feel safe enough, supported enough to wiggle and wobble. And we want that wiggle and wobble. We don't want to be rigid and stiff. We want to have freedom and flow and movement through our bodies. That starts from the ground up and from the top down, right? Sensory input goes both ways. But it's so important because your feet are contacting the ground all the time. So when you give your ankles, your heel bones, that little support, that little hug, then they go, oh, okay, I'm supported, so I can wiggle and wobble again. Okay. So that heel support's important. You want good arch support, but not really high arch support or really low arch support, just sufficient enough that you can sense the arch of your shoe, especially on the right. So a lot of places, a lot of PT clinics that I worked at or worked with, and the way I was trained in PT school, and a lot of the shoe stores will say, oh, if you have a high arch, you need like a really high, if your foot has a high arch, you want to get this high arched shoe or insole to support that high arch, which I don't necessarily agree with, because if you have a really high arch, that tells me your foot's having a hard time pronating, which means softening and flattening, which is a normal part of the gait cycle, the running gait cycle that we talked about last time. So if you have a really high arch in your foot, you would want a medium to maybe not the lowest arch, but a little bit lower, so that your foot can start to learn how to soften. So, that's unique to each individual, but definitely something to think about next time you're looking for a shoe and someone's trying to tell you to get a really high arch shoe. Um, okay, I think I covered all of that. Oh, this is another thing my runners don't like, but avoid wearing flip-flops, sandals, and wearing shoes that are untied during the running season. So I say during the running season, probably in general. Again, if it's summertime and you want to wear some cute sandals and you're not in rehab, please do that. But if you're a runner and you're putting in a lot of miles, or you're a walker or hiker and you're doing a lot of miles, try to do that as little as possible, because all of those things tell your body, I don't have a good floor, and then you want to tense again. It's just the way our bodies work. You lose that heel wobble because you don't have that support anymore. So if you're a runner, it's running season, you're preparing for a race, whatever, try to wear good shoes as much as possible. And you may or may not agree with me on that, but that is my personal recommendation. And I've seen that it's worked really well for a lot of people to do that. You just get better, faster with less injuries. So take it or leave it. That's my 2 cents. Okay, so let's get to this shoe list. So if you were able to pull it up in the chat box, you can download it there. But I'm just going to kind of talk you through it, and you can directly message me or send me an email if you, for whatever reason, need the shoe list and you couldn't access it here. So, qualities of a good shoe. So this is one of my shoes that I use. It's the Brooks Adrenaline. I don't have any kickback from Brooks. It's just one of the shoes that works for me. So the first thing I'm going to show you is the heel counter. So with this shoe, I can't squash it down. So I'm trying to press the back of the heel counter in and it won't budge, right? So that's the sign of a good shoe. Let me see if I can find a bad shoe. Oh yeah. So these are my husband's shoes. And of course I don't know about everybody else, but if you have some good advice that you learned at work, your spouse might not always take that advice. So these are my husband's shoes, and we could poke a little fun at him. But so this heel counter is, I would say, not a good shoe. It's just, really floppy. Also, he's having some knee pain, so just saying. Um, so that's one thing you want to look at is, does that heel counter fold in? Not good shoe. Good shoe. Okay. You also you want your toe box to be able to move. So unless you have an injury where your big toe or one of your toes doesn't bend back, you can't bend your toe up, you want a shoe that bends in the toe box because that's how you push off when you run. And your big toe sensing the ground and propelling you forward recruits the right muscles up your leg, your glutes and hamstrings, to propel you forward. So if you're not getting that bend in your toe, you're going to end up pulling yourself forward with your hip flexors and your neck. And we all know that's probably not going to feel good, right? So you want that toe box to move, but you don't want the whole shoe to move. So on this shoe, the toe box moves, but the rest of the shoe is pretty rigid. Like I can't really bend the middle of the shoe here. In this shoe, the toe box moves, but the whole shoe moves. You see that? So it's not providing any stability. So yes, the toe box moves, but we're not getting any good information from the rest of the shoe. Because you don't want your whole foot doing this. You want your toe box doing this, but the rest should stay supported. So again, the heel counter, if you're not getting that the heel counter is important by now, I'm not doing my job, but we don't want this to squish down. So I'm trying to squish it vertically, and this is really stable. It doesn't squash. So yay, that's another sign that this is a good shoe. Here, I'm gonna do the same thing, and it just kind of folds in, right? So we're not loving this shoe right now. The other thing I'm going to look at is the heel height. So a lot of shoes will have like an anti-pronation where the inside edge of the shoe is a little bit higher than the outside edge. And this one, it looks kind of like that a little bit because of this, what they call the guide rail here, but actually it's pretty symmetrical right to left, right? So this angle, you don't want a shoe that's higher on the inside edge to anti-pronate you because like we talked about last session, pronation is a normal and necessary part of the gait cycle. So you don't want to never pronate. So you don't want a shoe that never lets you pronate. So nice and level on the heel height, symmetrical right to left. So this one, looks pretty okay in that regard. One other thing that's not on the shoe list that I kind of look for is the rotational capacity of the shoe. So shoes should rotate a little on the diagonal axis. So this has a little bit of give when I'm bringing the big toe side down like so. Has a little bit of that rotation and not as much going the other way. So just that little bit of twist allows that foot to plant and push off of the big toe. So that's for running, walking, everything. There needs to be a little bit of that transverse plane angle through the foot. So being able to rotate that big toe down a little bit. That's not essential, but I'm finding more that can be important for people. Another thing I want to show you is, if you can see, this is where my heel sits. And I don't know if you can see with the lighting here, but it's a nice narrow little V shape. So you can see how that would give that little hug around your ankle. So that's very desirable. So this one, we kind of have that, but it's just kind of, it can be any shape it wants. So that's not telling your ankles, don't worry, I've got you. It's saying you better tense up because there's no support here. Okay, I'll stop beating up on my husband's shoes. Hopefully he doesn't watch this. I doubt he will. But so you can go through those criteria on your own shoe and see if it meets them or if it doesn't. But it's really important that when you try on a shoe, even if it meets all the criteria that I'm asking for, if you put that shoe on and it doesn't feel good, that is not the right shoe for you. Your body will tell you when you have the right shoe, because you will go, oh my God, I love how this shoe feels. It will feel good right when you put it on. You should not feel like you have to break in a shoe. If you feel like you have to break it in, it's not the right shoe for you. So try some others. Um, Also, when you're wearing your shoe and you're walking, just ask yourself, do I feel my heel, my arch, and my big toe on both sides? Do you sense them? So it won't be like, oh, I really feel it, but okay, I'm aware of that part of my foot in the shoe. Also, if you're a patient of mine or you're a prior patient of mine and you bought some shoes, or you're not sure if they're the right shoes, what I can do is take you through the tests that I usually, like some screening tests, and you'll see the difference with your shoes on versus off. Sometimes it can make a really big difference for people. So if you're not sure, you can work with your physical therapist or PRI trained physical therapist that will know about these shoes and be able to test you and your body and see what that shoe is doing for your body. So I just want to show you the back of this shoe list. Sorry, it's backward on your screen, but it says Fresca Clinic Prime Shoe List 2020. So this is the front with the criteria, and then there's the back with I think 4 different shoes on there. So these shoes on the back are the best for rehab. So if you're working through an injury and you are thinking about a shoe to get, I would look at the back of this list first. That's the A6 Cumulus 21, the A6 Nimbus 22, A6 Kayano 26, Brooks Adrenaline 20. And that's what I think this is, the Brooks Adrenaline. I'm not sure. I don't think this is the 20. This is from a year before, but that number does matter because some brands will make the same shoe. So like this is the Brooks Adrenaline. And it might be, the 18, 19, 20 are all good, but it might be that the year before that it didn't meet the criteria because they make little changes to shoes all the time. So if you're looking at the shoe list, make sure you're getting the shoe on that list, not one from a year before. And if you're looking to buy shoes and save some money, just let me know. I can send you some of the lists from the prior years so you can buy an older shoe and see if it works for you that way. Just know you might have to order a few pairs because you'll probably only be able to find them online. It's important that you try them. So I think that's all I had for today. It's just a little bit of a shorter session. And it actually ended up not being even that much shorter. But I want to just see if there's any questions. Okay. So yeah, just let me know directly if you weren't able to download that file or get that list. And that's it for today. So if you have any questions, please feel free to send me an email if you think of anything later. My email is Derya, DERYA, at myessentialpt.com. You can also find some articles and videos about picking a shoe on my website, and that's myessentialpt.com. So thanks so much for tuning in. And I just had a quote from somebody in the chat box. I love my shoes from your shoe list. So that's a patient of mine. I'm glad to hear it. They really do make a difference. It's surprising how much of a difference it can make. So thanks for sending that. Okay, well, I'm going to go ahead and sign off. And thank you so much for joining.